They're a priority vaccination group, people working at long-term care and retirement homes, but not everyone is getting the shot. And the local health unit is not tracking how many employees are declining their dose. A family whose mom is at a home in Windsor says this is creating a gap in protecting vulnerable seniors. The CBC's Mrinali Anchan reports.
It's been a concern since January. That's when Windsor Regional Hospital conducted a poll, finding that about 20% of healthcare workers in homes and hospitals were refusing or delaying their request for a vaccine. But now, 3 months later, we don't know where exactly that number stands today. Windsor's local health unit isn't tracking it, neither is the province.
Let's give the maximum protection we can to our vulnerable people. Let's put an iron ring around the home.
Vaccine hesitancy has this son worried for his mother's safety. The Toronto resident is worried unvaccinated staff could bring the virus into his mother's Windsor retirement home, Amica Riverside. His last name is being withheld by CBC News out of concern for his mother's continued home care. The home says 90% of staff have been vaccinated, with more awaiting vaccination. Eugene's mother, Jeanette, has both her shots, but he says it's still not enough.
So she's kind of going through some stages of Alzheimer's. And of course, that makes new things difficult for her to hang on to. In particular, COVID requirements like washing your hands regularly and that sorts of thing. Don't touch your face. She has a hard time remembering or understanding why it's important. Now,
the health unit says while it doesn't know how many have opted out, anytime an outbreak is declared, unvaccinated staff are kept out of facilities.
I think the failing is that the public health unit isn't being proactive enough. I mean, the policy here seems to be wait until something is wrong and then react.
According to an infectious diseases physician, the lack of data around this can make reopening safely more difficult. Dr. Zain Chagla says, "We want to see as much of the community vaccinated, but we know particularly seniors are a vulnerable group with reopening. Staff as well, given they can be linked to many outbreaks, are an important part of this." Other regions like Chatham-Kent are keeping track of these numbers. There, staff vaccinations in long-term care homes are only at around 50%. The Ministry of Health says employers may choose to set their own policies for vaccination of their employees, but the province at large does not have guidance on preemptively keeping unvaccinated staff out of homes before an outbreak, nor does it have any plans to start tracking the number of unvaccinated staff in the future. Mrinali Anchan, CBC News.